Good day, Marines. As the medical officer of the Marine Corps, threats to force health protection are an area of significant focus for leadership and for our office. One such emerging threat is the Zika virus. There has been a steady increase in the number of reported cases, as well as a reported link to complications in fetal development during pregnancy. The Zika virus is primarily spread by mosquitoes, though in rare instances it has been reported to have been contracted from sexual transmission with an infected individual. The virus has been localized to Africa, Asia, and the Pacific Islands, but in May of 2015 it began spreading into Central and South America, the Caribbean, Mexico, and Puerto Rico. The most common symptoms of an infection with the Zika virus are a fever, rash, joint pain, red eyes, muscle pain, and headaches. The illness is generally mild, with symptoms lasting from several days to a week. There is no vaccine to prevent the disease, nor are there any specific medications for treating Zika. In rare instances, a severe case could require hospitalization. The Centers for Disease Control, along with other government and international agencies, are actively taking steps to respond. One such step included the CDC issuing a travel alert for women who are pregnant or trying to become pregnant to postpone travel to areas with the Zika virus. There has been one reported case of the Zika virus that is reported to have been contracted inside the United States, possibly from sexual contact with an infected partner. All other reported cases within the United States were contracted while the individuals were traveling outside the country. If your mission requires you to deploy to an area where the Zika virus may be present, it is important that you take appropriate precautions. You must be aware of the risks and understand a few basic personal protective measures you can take to avoid becoming infected. The most effective way to prevent the infection is to practice strict personal preventive measures that include using insect repellents and wearing long-sleeve shirts and long pants to protect yourself from mosquito bites. All service members and family members who have traveled to Zika-affected areas and suspect they may have been infected with the Zika virus should inform their healthcare provider and immediately report their travel history. This is particularly important for pregnant service members and family members. Recommendations and guidance may change as new information becomes available. For additional information, I encourage you to review the policies within your chain of command. You can also log on to www.cdc.gov for real-time updates. Your health is our mission. Semper Fidelis, Marines.